I'm very aware of the time. I've got quite a few slides, but I'm going to go through them very, very quickly and skip and give you a kind of highlights tour. So once again, this is a focus group study, and the aim of this one was to explore cultural influence shaping Australian Chinese migrant cancer patients' pain management experience, so from their own view. And the framework, again, was Leninger's theory of cultural care we used. So they were focus groups. People had to be born in China, Hong Kong, or Taiwan and have come here as a migrant. We really largely recruited through Can Revive and other cancer support groups that are run for Chinese people in particular. And we also administered the short form barriers questionnaire as well as the focus group to get an idea of barriers encountered. And the key thing about data analysis was that both Renee, who is Chinese herself, and myself both independently analysed the data and then met to discuss, so that we had both a kind of insider and an outsider perspective on the data. So the focus groups had 24 people take part. Most were women, had lived in Australia for a long time, as you can see. And even though most of them had pain, very few of them had actually used opioids. So their mainstay of pain treatment had been paracetamol and things like massage and heat, non-pharmacological. So the short form barriers questionnaire showed that people had very high barriers except for those in red: religious fatalism and fear of distracting physicians. So this data sort of agrees with the nurses' perception that religion was very low for this group. However, it was interesting that they still had beliefs that their cancer pain was provoked, but it was not in a religious fatalistic way. Instead, it was around the lifestyle that they'd had. They believed that their cancer had been caused by lifestyle factors and that pain was an inevitable part of that. And they also had a belief, expressed a belief that the body can self-heal as well, so that it could work both ways, and they were actively engaged in fighting their cancer through lifestyle ways. Many of them expressed a belief that cancer pain's inevitable side effect of the treatment, and they tended to associate it more with the treatment than the cancer itself. And also did certainly agree with the nurse perceptions that they expressed their pain differently, but they didn't necessarily talk about that in terms of stoicism or it being against cultural norms to express your pain. It was more around how they really wanted to understand the pain themselves, and they didn't necessarily feel the need to involve health professionals in that or to talk to them about management of it. And it was interesting how they contrasted themselves with the locals. Even though most of them had been here for 20 years, they still very much saw themselves as different. And they talked about the locals do this, we Chinese people are different, we view our pain differently. Some of them even thought that the locals had a more positive approach to the way they dealt with their pain. Some of them had a different view, but the key thing was that they thought it was very different. As mentioned by the nurses earlier, yes, there was a fear of addiction to opioids, as we see in all cultural groups, but they also expressed beliefs that the opioids would harm parts of their body which were culture-specific, harm various organs in the body, so it was a bad idea. But that there was a place for opioids at the end of life, and in fact expressed a belief that opioids could extend people's life if you took them at the end, because otherwise you would actually die of the pain potentially. But opioids could actually enable you to live longer. So we're very open to using opioids at the very end of life, but not earlier on. Whereas the nurses expressed a view that patients were very reliant on their families, certainly the patients talked a lot about family, but it was more in terms of feeling that they were burdening their family, and they didn't want to burden their family, and with things like pain. But they were very grateful for peer support, and particularly the Chinese support groups that they'd had. it was interesting how we might think of China as a middle-income country, but many of them actually expressed views that the care they received in Australia was quite poor compared to the care they would have expected in China. The access to things like pain care, to physiotherapy, or assistance with exercise, non-pharmacological approaches to managing pain, they saw as being much inferior in Australia than they would have expected in China. And even things like psycho-oncological support as well, they felt were not as accessible here, which was interesting. So as the nurses suggested, they certainly did talk about wanting to use traditional Chinese medicine, but that they were very aware that might clash with their Western medical treatments, and sometimes they were happy to stop using their traditional Chinese medicine, particularly for anti-cancer treatment, less so for treatment of symptoms. But for the anti-cancer treatment, they were quite worried about the quality of the traditional Chinese medicine practitioners here in Australia, and of the herbs and the medicines that they were given by them as well. And the unaffordability. So many of them expressed, difficulty with financial access for traditional Chinese medicine, and also for the Western medicine. So not surprisingly, there were these health literacy concerns, which we've heard about a lot. It was very noticeable that of nearly all of them had received almost no information at all about cancer pain management. They felt that they really had not been had much understanding or information given to them around that. They weren't sure where to go to seek help other than through the support groups that they had accessed. I'm just going through very, very quickly. So again, similar to the nurse surveys, there was expressed this need, and it's great to see the Cancer Council's been working on more of these resources. So in summary, these focus groups suggest that the barriers are quite similar actually to those shown by René's systematic review of the Chinese literature for people back home in China. And it's important to stress that while on the surface some of the barriers to things like opioid use might look the same, in fact there may be some cultural differences underlying those that would need addressing for if opioids are indeed the best management strategy for pain. But an emphasis really on the need for more non-pharmacological pain management. And I think that's something we don't do very well for people of any cultural group. We tend to default to opioids very quickly for pain in cancer. And I think nearly everybody would actually prefer that to be a last rather than a first resort. But Chinese migrants being a case in point for that particularly. And again, just to emphasise, that these were all people from Sydney, and we recruited through these Chinese support groups. But if anything, that probably means they underestimate the challenges faced by this group, because these were fairly switched-on people who'd taken the effort to go and join these Chinese support groups. So people who were not doing that probably had even less support for them. So I think the key message for the clinicians out there is to ask about pain. It's not necessarily that people don't want their pain managed, it's just they want that managed in a culturally appropriate way. And also that we do need to be having these discussions, as was raised by previous speakers, about traditional Chinese medicine and Western medicines. But we need to be doing that in a very non-judgmental, open way that encourages discussion and negotiation, not a very kind of, you shouldn't be using that, you should be using our vastly superior medications. Okay. Thank you very much.